Not being able to lift your leg after knee replacement surgery can be a scary thing. And sometimes you don't have the same strength, you don't have the same coordination to do the normal activities that you previously would. Most commonly, the reason would be that it's pain. Sometimes with increased pain after a surgery because your knee's been opened up and sewed back together, it actually has increased amount of swelling and it's just uncomfortable. And it's something we call pain inhibition. So the muscles are actually inhibited from doing the normal activities just because there's so much discomfort around. And this could be addressed by the physiotherapist and by the doctors with suitable medication and ice and elevating, compression, all these lots of things we can do to help manage the amount of pain and swelling you get so that you get more mobile more quickly. Another thing to consider, when you immediately wake up, you may be still under the effect of the anaesthetic itself. So the anaesthetic may be a spinal anaesthetic, which can actually directly stop the muscles from working, and this can take sometimes 6 to 12 hours to resolve. Another thing that may have happened, you may have had a nerve block, so the nerve itself that supplies the muscles have been directly injected and can sometimes be weak while that nerve block is in place, and again that can resolve over 6 to 12 hours. But long term you'll find that your strength and your ability to raise your leg, hold it out straight will improve with time, and the muscles will eventually get stronger and hopefully even stronger than what you were pre-operatively.